All right, let's get right into it. We all know that moment. A pregnant or breastfeeding patient walks up to the counter, and suddenly the stakes feel a whole lot higher. This is all about giving you the tools to handle those conversations with total confidence, making sure your advice is both safe and effective.
So, picture this. It's Tuesday afternoon, the pharmacy is busy, and a pregnant patient asks you for something for her cough. What goes through your head? What's the first thing you reach for? It's not just a simple question, right? This is exactly why having a solid game plan is so critical.
Okay, Section 1, Guiding Principles for Self-Care. Before we jump into specific drugs, let's lay down some ground rules. Think of these as the fundamental principles that should guide every single recommendation you make. They're simple, but honestly, they're everything.
First up, and this one's huge, whenever you possibly can, go for a topical or locally acting therapy instead of something systemic, right? If you can treat the problem right where it is, do it. We're talking about things like a clotrimazole cream or a nasal spray for allergies. Why? Because the amount that gets into the bloodstream is tiny, and that minimizes any potential risk.
Now, this one is really important because it requires some of our clinical judgment. Lack of data doesn't automatically mean unsafe. We all see that phrase and get a little nervous. But take something like guaifazine during breastfeeding. Yeah, there aren't specific studies, but based on how the drug works, experts don't really expect any risk. So it's about using our brains, not just having a knee-jerk reaction to a lack of data.
And of course, this is basically Pharmacy 101, but for this population, it's on steroids. Always advise the shortest possible duration of therapy at the lowest effective dose. This is our go-to safety net for everything, from telling a patient to use a stimulant laxative for just a couple of days to avoiding codeine altogether in breastfeeding. It's a non-negotiable.
All right, Section 2, Navigating Common Conditions. Let's take those principles and actually apply them. We're going to run through some of the most common things you'll see at the counter. Think of this next section as your quick reference guide.
Okay, for pain, fever, or that classic pregnancy backache, it's pretty straightforward. Acetaminophen is your go-to, the drug of choice, period. But here's the absolute hard stop you need to remember. Avoid NSAIDs and aspirin in the third trimester. That is a critical safety warning. So back to that patient with the cough. What do we tell her? Dextromethorphan and guaifenesin are your best bets. And see, this is a perfect example of that lack of data principle. We consider them likely safe in breastfeeding even without a ton of studies. The huge red flag here, though, avoid codeine while breastfeeding. We have much safer alternatives. For allergies, the good news is we have some really great safe options. You're going to want to reach for the second-generation antihistamines first, thanks to tyrosine or loratadine. And even better, those intranasal corticosteroids like fluticasone. Remember our first principle? They work right in the nose with almost no systemic absorption, which makes them a fantastic choice. Now, let's talk decongestants, because this is where it gets a little more nuanced. With pseudoephedrine, some older advice was to avoid it in the first trimester, but newer data is actually pretty reassuring. Phenylephrine, on the other hand, there's more concern there about potential effects on uterine blood flow, and a huge counseling point for breastfeeding moms. Pseudoephedrine can tank their milk supply, especially early on, so you've got to be careful with that one.
Let's quickly run through GI issues. For constipation, you're going to start with bulk-forming agents like psyllium, super safe. For diarrhea, things like adipalgate are fine, but just remember to avoid bismuth subsalicylate in that third trimester because of the salicylicate. And for reflux or GERD, you've got a whole arsenal. Antacids, famotidine, even PPIs like omeprazole are considered safe.
Okay, Section 3, Critical Warnings and Referrals. Look, knowing what to recommend is half the battle. The other half, and it's just as important, is knowing what not to recommend, and when it's time to say, you need to see your doctor. This is where we really shine as a safety checkpoint.
At the end of the day, our most important job is making sure our patients are safe. It's our prime directive. That means knowing the hard and fast contraindications and having that internal alarm that goes off when you hear certain red flags, like symptoms that sound more like a bacterial infection. Self-care isn't always the answer, and it's our job to know the difference.
All right, these are the absolute must-knows. I want you to burn these into your memory. Avoid NSAIDs and aspirin in the third trimester. Avoid codeine in breastfeeding. Avoid salicylates in the third trimester. Don't recommend hydroquinone for cosmetic stuff. And always refer for things that need a diagnosis, like a fungal nail infection. This list is your ultimate safety net. Okay, last section, your counseling checklist. We've got all this great information, but how do we actually use it when we're juggling 3 phone lines and a queue of patients?
Let's build a simple, repeatable process you can use every single time. Here it is, your 5-step plan for every single one of these conversations. Step 1, confirm what's actually going on with their symptoms. Step 2, and this is crucial, verify their status. Are they pregnant, what trimester, or are they breastfeeding? Step 3, make your first-line recommendation. Step 4, give them the key warnings and tell them how long to use it. And finally, Step 5, tell them when it's time to call the doctor. That's it, simple, safe, and efficient. So I'll leave you with this question to think about. How can you make this conversation a standard of care in your pharmacy? How can you make it second nature? Because when you do, you're not just selling a product, you're protecting your patients and you're demonstrating the incredible value of a pharmacist. And that's what it's all about.